What if I told you the heaviness in your legs after 60 may not be normal aging, but an early warning that your blood flow is slowing down right when you need stability the most? Most people don't notice circulation problems while sitting safely in a chair. They notice them at the worst possible time, standing up from the couch, walking to the bathroom at night, or taking that first stiff step in the morning. And that's where the danger begins. Poor blood flow can make your legs feel cold, weak, numb, or slow to respond. And after 60, even a small delay in how your legs react can be the difference between catching your balance and falling. But here's the part most seniors are never taught. You don't always need harder workouts. You need the right simple movements that wake up your calves, thighs, and circulation system before weakness becomes your new normal. Today, I'll show you 5 simple exercises that can help support better blood flow in your legs, safely, practically, and starting right at home. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. The ankle pump, the small movement that can restart blood flow in minutes. You might not think much about your ankles until one day your feet start feeling cold, numb, or strangely heavy after just sitting for a while. And here's what surprises many of my older patients: that uncomfortable feeling isn't just stiffness. It's often a sign that blood is slowing down in your lower legs, especially after long periods of sitting, which is very common in daily American life, whether it's watching TV, reading, or driving. What most people don't realize is that your calves act like a second pump for your circulation. When they don't move, blood tends to settle in the lower legs. Over time, this can lead to swelling, tingling, or even increase your risk of losing balance when you stand up too quickly. The good news is there's a simple movement that directly targets this issue, and you can do it almost anywhere without drawing attention. Sit comfortably in a sturdy chair with your back supported and both feet flat on the floor. Now, slowly lift your toes upward while keeping your heels planted. You should feel a gentle tightening in your shin muscles. Then reverse the motion. Press your toes downward as if you're lightly pushing a gas pedal, allowing your heels to stay in contact with the ground or slightly lift naturally. Move in a smooth, controlled rhythm, not fast or jerky. Aim for about 1 full up and down cycle every 2 seconds. Start with 20 repetitions, rest for a moment, then repeat another set if it feels comfortable. Over time, you can build up to doing this for 1 to 2 minutes at a time, especially during periods when you're sitting for longer than 30 minutes. Many people find it helpful to do this during commercial breaks or while waiting for the kettle to boil. Simple moments that add up. What matters most here is consistency, not intensity. This is not about pushing hard or feeling strain. It's about gently activating the calf muscles so they can assist your veins in moving blood back toward your heart. If you have conditions like severe arthritis, nerve pain, or recent surgery, move within a pain-free range and consult your physician if anything feels unusual. If you've been noticing that your legs feel heavier at night or your feet take longer to wake up in the morning, this small habit can make a noticeable difference over time. And once you feel that subtle warmth returning to your feet, you'll understand why this movement is often the first step I recommend. But here's the real question most people don't ask. What happens when your circulation problem isn't just from sitting, but from muscles that have already started weakening. That's exactly where the next movement becomes critical. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Seated marching, the exercise that wakes up weak, sluggish legs. It often shows up in the quietest moment, and you stand up from your favorite chair, and for a second, your legs don't feel as steady as they used to. Not painful, not dramatic, just a slight hesitation. That hesitation is your body telling you something important. Your muscles and circulation are no longer working together the way they once did. As we age, especially past 60, the large muscles in the thighs and hips begin to weaken if they're not regularly activated. These muscles play a critical role in helping blood move through the deeper vessels of your legs. When they become less active, circulation doesn't just slow down, it becomes less efficient. That's why some people feel lightheaded or unstable when standing, particularly after sitting for extended periods. This is where seated marching becomes one of the most practical and effective movements you can introduce into your daily routine. It's simple, controlled, and designed specifically for people who may not feel comfortable doing standing exercises yet. Sit in a firm chair with your feet flat on the ground and your back upright, not slouched. Place your hands gently on your thighs or hold the sides of the chair for support. Now slowly lift one knee upward, just a few inches off the seat. No need to go high. Focus on controlled movement rather than height. Hold for a brief moment at the top, then lower it back down gently. Alternate to the other leg and repeat the same motion. The key here is pacing. Move slowly enough that you feel your muscles engage, but not so slow that it becomes tiring. A steady rhythm, about one lift every 2 to 3 seconds, works well for most people. Start with 10 repetitions per leg. If that feels manageable, you can gradually increase to 15 or even 20 over time. What makes this movement so valuable is how it re-engages the larger muscle groups that assist circulation in the upper legs. Unlike smaller ankle movements, this exercise helps stimulate deeper blood flow and improves coordination between muscles and blood vessels. Many older adults notice that after practicing this regularly, they feel more stable when transitioning from sitting to standing, a critical moment where many falls occur. It's especially helpful to do this exercise before standing up after long periods of sitting, such as watching television or reading. Think of it as a gentle wake-up call for your legs before asking them to support your full body weight. If you have hip discomfort or joint stiffness, keep the movement within a comfortable range and avoid forcing the lift. The goal is activation, not strain. And as always, if you experience pain or unusual symptoms, it's wise to consult your healthcare provider. Over time, this simple habit can help restore confidence in your movements, not by pushing harder, but by moving smarter. But here's something most people overlook. Even if your muscles are working better, what if gravity itself is still working against your circulation when you rest? That's where the next technique becomes surprisingly powerful. 3. Heel raises, the overlooked movement that strengthens circulation where it matters most. It doesn't happen all at once. One day you're walking fine, and the next, your legs feel a little heavier going up the stairs, or you catch yourself holding onto the railing more than you used to. That subtle shift is often tied to something deeper than just getting older. It's usually a sign that the muscles responsible for pushing blood back up your legs are no longer as strong or responsive as they once were. Your calf muscles play a crucial role in circulation. Every time they contract, they help push blood upward against gravity, back toward your heart. When these muscles weaken, which naturally happens with age, especially if you're less active, blood tends to linger in the lower legs longer than it should. That's when symptoms like swelling, fatigue, or that heavy dragging sensation begin to show up. This is why heel raises are such a valuable exercise. They may look simple, but when done correctly and consistently, they directly target one of the most important mechanisms your body uses to maintain healthy blood flow. Stand behind a sturdy chair or near a kitchen counter, something stable you can lightly hold on to for balance. Place your feet about hip width apart, keeping your posture upright but relaxed. Now, slowly rise up onto the balls of your feet, lifting your heels off the ground. You don't need to go as high as possible, just high enough to feel your calf muscles engage. Hold that position for about 2 seconds, then gently lower your heels back down to the floor. The key here is control. Avoid bouncing or rushing through the movement. A slow, steady pace at about 3 seconds up, 2 seconds hold, and 3 seconds down allows your muscles to fully activate. Start with 8 to 10 repetitions. If that feels comfortable, gradually work your way up to 12 or 15 over time. This exercise is especially helpful during the day when you've been standing for a while, such as in the kitchen or while doing light chores. It helps prevent blood from pooling in your legs and can reduce that tired, achy feeling many people notice by the afternoon. If balance is a concern, always keep one or both hands on a stable surface. And if you feel any sharp pain or dizziness, stop and rest. This movement should feel like gentle strengthening, not strain. Over a few weeks, many people begin to notice subtle but meaningful improvements. Their legs feel lighter, they move with more confidence, and daily activities require less effort. It's not about dramatic changes overnight, but about rebuilding a system your body relies on every single day. But here's something most people don't think about. Even if your muscles are working better during the day, what happens when you lie down and your circulation shifts again? That's where the next simple technique can make an unexpected difference. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Leg elevation reset. The nighttime habit that helps your legs feel lighter by morning. There's a moment many older adults notice but rarely talk about. You lie down at night, and instead of feeling relief, your legs still feel heavy, tight, or slightly swollen. Some even wake up during the night with discomfort or stiffness that wasn't there years ago. That's not just fatigue from the day, it's often your circulation struggling to fully recover. During the day, gravity constantly pulls blood downward into your legs. Even if you stay active, small amounts of fluid and blood can accumulate in the lower extremities, especially after long periods of sitting or standing. By the time evening comes, your veins have been working hard all day to push that blood back upward. If they're not as efficient, which is common after 60, that leftover pressure can linger into the night. This is where a simple technique called leg elevation can make a meaningful difference. It's not about exercise intensity. It's about using gravity in your favor rather than fighting against it. Lie down on your back on a bed or a comfortable surface. Gently raise your legs so they are slightly above the level of your heart. You can do this by placing 2 or 3 pillows under your calves or by resting your legs up against a wall if that feels comfortable. The position should feel supportive, not strained. Your lower back should remain relaxed and your neck supported. Stay in this position for about 2 to 5 minutes. You don't need to stay longer for it to be effective. While your legs are elevated, breathe slowly and naturally. Avoid tensing your muscles. The goal here is passive support, allowing gravity to assist the return of blood toward your heart. What's happening during this time is subtle but important. The pressure in your leg veins decreases, excess fluid begins to shift, and circulation becomes more balanced before you go to sleep. Many people report that when they do this consistently, they wake up with legs that feel less stiff, less swollen, and easier to move. This can be especially helpful if you notice ankle swelling, a tight feeling in your calves, or if your shoes feel slightly tighter by the end of the day. It's also a useful habit after long periods of sitting, such as traveling or spending extended time watching television. However, there are a few situations where you should be cautious. If you have certain heart conditions, severe back pain, or feel dizzy when lying flat, it's important to adjust the position or speak with your healthcare provider before continuing. This is not a quick fix, but rather a gentle, supportive habit that helps your body reset each evening. Over time, it can reduce the strain your circulation system faces day after day. But here's something many people don't realize. Even if you improve circulation at night, what you do during the day still determines how well your blood flows overall. And that's where one final movement, often done incorrectly, can either limit your progress or quietly accelerate it. 5. Gentle walking intervals. The smarter way to improve circulation without overexertion. Most people believe that if their legs feel weak or stiff, the solution is simple: just walk more. But here's what I often see in my older patients across the US. They walk the same slow pace every day, and over time, their progress stalls. Their legs don't feel lighter, their balance doesn't improve, and they start wondering if walking is even helping at all. The issue isn't walking itself, it's how you walk. As we age, blood vessels can become less flexible, and circulation doesn't respond as quickly as it used to. When you walk at the same comfortable pace without variation, your body adapts. And eventually, that level of activity is no longer enough to stimulate meaningful improvement in blood flow. This is where gentle walking intervals come in. It's a simple adjustment, but it can make your walking routine far more effective without making it harder or unsafe. Start by walking at your normal, comfortable pace for about 2 to 3 minutes. This should feel easy. You can talk, breathe comfortably, and stay relaxed. Then, for the next 20 to 30 seconds, slightly increase your speed. Not a sprint, not a strain, just a noticeable step up. Your breathing may deepen slightly, but you should still feel in control. After that short burst, return to your normal pace for another 2 to 3 minutes. Repeat this cycle for about 10 to 15 minutes total. That's all you need to start. What this does is gently challenge your cardiovascular system. Those short increases in pace encourage your blood vessels to open more effectively, improving circulation without putting excessive stress on your joints or heart. Over time, this can help your legs feel more responsive, reduce that heavy sensation, and even improve endurance for daily activities like climbing stairs or walking through a grocery store. This approach is especially useful if you felt that your regular walks aren't doing much anymore. It gives your body a reason to adapt again, but in a safe, manageable way. If you're new to this or have concerns about balance, choose a familiar, flat, Walking area such as a sidewalk in your neighborhood or an indoor space like a mall. Wear supportive shoes and avoid uneven surfaces. If you ever feel dizzy, overly fatigued, or uncomfortable, slow down and rest. It's also important to be consistent rather than intense. Even a short 10-minute session done most days of the week can lead to gradual, noticeable improvements in how your legs feel and function. What many people begin to notice after a couple of weeks is subtle but meaningful. Their steps feel lighter, their legs respond more quickly, and daily movement becomes less of a challenge. And now, here's the bigger picture most people miss. Each of these simple movements works on a different part of your circulation. But when you combine them correctly, they create something much more powerful, something that can truly change how your legs feel day to day. The quiet turning point. What you do today shapes how your legs will carry you tomorrow. There's a moment in life that doesn't come with a warning. It's not a diagnosis, not a dramatic event, just a gradual realization that your body doesn't respond the way it used to. Your legs feel heavier at the end of the day. Getting up takes a little more effort. Balance feels just slightly less certain, especially at night when the house is quiet and the lights are low. This is the stage many adults over 60 find themselves in. Not sick, but more vulnerable than they were before. What matters most is understanding this. Your body is not failing suddenly. It's adapting slowly to years of reduced movement, weaker muscles, and less efficient circulation. And if left unaddressed, these small changes can quietly build into larger problems. Circulation, in particular, plays a central role in how your legs function. When blood flow slows down, muscles receive less oxygen, nerves become more sensitive, and your ability to react, to catch yourself, to stay balanced begins to decline. This is why so many falls happen not during activity, but during simple transitions. Getting out of bed, walking to the bathroom at night, standing up too quickly after sitting. The exercises you've just learned are not about intensity or pushing limits. They are about restoring communication between your muscles and your circulation system. Each movement targets a different part of that system, from the small pumping action in your ankles to the strength in your thighs to the role of gravity when your body is at rest. What makes these habits powerful is not how difficult they are, but how consistently they are applied. If you ignore these early signs, the next 1 to 5 years may bring changes that feel increasingly limiting. Walking distances may shorten, confidence may decrease, activities you once did without thinking may require more planning or assistance. And with that often comes a loss of independence, something no one talks about openly, but many quietly fear. But the opposite path is also possible. When you begin to support your circulation daily, even with small intentional actions, your body responds. Not overnight, but steadily. Muscles stay engaged. Blood flow improves. Movements feel more stable. And most importantly, you maintain control over your day-to-day life. This is not about reversing age, it's about respecting it and working with your body instead of against it. So as you move forward, don't think of these exercises as tasks to check off. Think of them as signals you're sending to your body, a reminder that it still matters, that it still has support, and that you're choosing to stay active in your own care. Because the difference between feeling uncertain and feeling steady on your feet often comes down to the small things you decide to do today. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.